Hey everyone, the Elizabeth Scala here with another video about recovering after elbow surgery from a patient's perspective. So I had surgery in August and recovered through that fall and winter afterwards. And today's video will be brief. I just want to talk about the scar, your arm, and the skin itself. First off, I am not good with blood, guts, queasy looking things. My family, my husband, even my neighbor who was with me the day I fell can speak to this, attest to this, because anytime, like, my husband is in heating and air conditioning. He's a service technician in heating and air conditioning and refrigeration. And he'll come home from work, maybe with a slice from some duck, or potentially something like fell and like really dented a finger, and he has a huge blister, blood blister, I don't know. So my husband will like show me these things and I'm like, ugh. So I am not good with things that make you go, ugh, okay? And one of those was the scar. But I want to talk about this in case you're wondering what to expect, what will happen, all that sort of thing, and also how to make sure it heals. Because despite the fact that I'm really not good with blood, guts, and things that make me feel queasy, I did a really good job at taking care of my scar. You can see, I mean, it is really clean. It's not red. I actually was looking for it before this video and I was like, wow, I can't even really see it anymore. So I did a really good job with taking care of it. And so I want to talk to you about that. So after surgery, you'll either have sutures or stitches. That's what my surgeon told me. It was going to be one or the other, and he was going to figure it out during the surgery. It depended on the skin and the size and what have you. So I'm not sure exactly what you're going to have, but you'll have something that's like sewing the skin together. Ugh. See, it makes me... You'll have something keeping the skin together. And for 10 days, for me, again, everything I say kind of take with a little grain of salt, because your body will be different, your surgeon will be different, the protocols will be different probably. But for me, it was 10 days from surgery day that I had my first post-op visit with my surgeon. And that's when they removed the hard splint that was there, the molding that was around my arm, keeping it in place, and all of the wraps, the gauze and everything. They removed all that. And my arm was exposed to air. And I was like, oh my goodness, this feels so warm. My skin is breathing, But there it was. There were these black, brown, reddish kind of coloring things that were along this scar. And my surgeon said to me, they'll fall off within a week. So you don't have to do anything, and don't worry if they get wet. Again, this is for me, follow what your surgeon says. You can get them wet. They'll kind of dissolve. They'll fall off within like a week. And I am off now to occupational therapy. And my occupational therapist inspected the sutras. Oh, they look so pretty. They look good, love it, la. And I'm like, ugh. Anyway, she would inspect them at every visit that I had. And it was taking longer than a week. And I told her, I was like, well, Dr. So-and-so said that they were going to fall out. And she's like, oh, don't worry about it. I'll just remove them. So she took it upon herself to use her scissor and kind of clip them out. Again, I was like, please don't show me, please, whatever. She said, now, Elizabeth, I understand that this makes you feel queasy. I hear you. I feel you. I got you. But if you want this to heal, you're going to have to get used to it. Love it. Play with it. Feel it. Massage it. Look at it, right? So she took those sutures out, and then my arm is exposed, and she inspected the scar then at every visit. She also would move the skin around it like this, and move the skin this way, and just move it every which way. And she said that was like a home exercise for me as well, that in the evenings I should take some lotion, which I would. And I have another video about when I would talk to my elbow. But I would take some lotion, and trust me, it was difficult. She told me to do this every single night. I probably did it 3 or 4 times a week. I'm not lying. But take some lotion, and I, gently did what she was saying. I never looked. It was very, very difficult for me to look. One day I was getting out of the shower, I remember, and for some reason my arm, like the way I was doing something with my arm or with the towel or whatever, and I saw my arm in the mirror and I lost it. You know, I started sobbing and I was like, I'm grotesque and I'm going to be so ugly forever in my arm. It's disgusting. And I was also like, oh, it's so gross. Like I just was miserable about it. But with time, with doing what I was told about the massaging, with letting my therapist move the skin and massage the skin. So you want the skin to move and you want to massage it and you want to get the skin kind of moving around the bone because you don't want the scar tissue to adhere to the bone, to attach to things inside. And then you don't have any movement. And then the scar actually, my occupational therapist told me it would get like thicker, it would be probably more swollen, and you know, you would see it more pronounced, and you would have problems with scar tissue if I didn't do what I did when I did it. So if you are given instructions about massaging the scar, moving the scar skin around, do whatever the things they tell you to do. And I have other videos about scar and skin safety, like keeping it out of the sun and what have you. So if you want your scar to look, like I said, like really clean and really fresh and, you know, really almost not visible, like if I were back here to the naked eye, you know, it's not really visible. So take care of the scar, do what you have to do to move that skin, to massage that skin after those sutures or stitches are either removed or fall out. But definitely take care of it and follow those orders prescribed to you. Do your best to do the things at home as well. And like I said, now you would have just a beautiful scar for the rest of your life, right? All right, so questions, comments, leave those below. You know the drill. Thanks for tuning in. For more resources or to connect with me, visit my website, elizabethscala.com. And if you have any topics for videos, like if you're like asking yourself or wondering, let me know, you know, leave a question below and whatnot, and I would try to make a video to answer your questions. All right. Take care. We'll see you next time.